Hi there, welcome to a presentation by CBH Education on our pharmacy revision series. Today we're going to be talking about metronidazole. So, metronidazole, some of the key words is that it's an antibiotic, it's anaerobic and broad spectrum. So, metronidazole, so how does it work? It enters bacterial cells by passive diffusion. So just a reminder from your A-level or GCSE revision, diffusion is a process of molecules going from a high concentration to a low concentration. So in anaerobic bacteria, this generates a nitroso-free radical. So obviously you've got a free radical, it binds to DNA, reducing the synthesis, therefore causing DNA degradation and cell death. And obviously this kind of mechanism, when obviously it's killing the bacterial cell, is bactericidal. There are quite a few side effects attributed with metronidazole. The ones that are listed here are just taken straight from the BNF, which are the common side effects. As some of the ones that you do tend to see, obviously in practice, will be the hallucinations, the headache, the neutropenia, the seizures, obviously if they're interacting with other drugs, skin reactions as well, and the dark urine. This is some of the side effects clinicians have come across which have been reported, and obviously patients have explained as well. Now, some of the drug interactions is that it's with lithium, so obviously you need to avoid this or reduce the dose, and obviously warfarin as well. This will increase the anticoagulant effect of it. So basically, again, it's just looking at reducing the dose of warfarin as well and monitoring that as well. So metronidazole, some of the common things that you see that will help you with your revision and what you see in clinical practice. So the good thing is with this drug, in the BNF, there's no MHRA warning stated with this. However, one thing that patients need to be counseled on, and this is what you will get definitely in your OSCEs, is about counselling with antibiotic, and particularly in universities, they like to do metronidazole because it's associated with one of the key drug interactions, or is the use of alcohol. Do not drink alcohol while taking this medication, so you avoid alcohol completely throughout the course of this medication. Now, some professionals will say to you that if you're on a 7-day course, you avoid alcohol for 9 days. Absolutely key. Take with food or just after a meal. Now, another thing that you do tend to find in practice as well, patients who are being treated for rosacea, they're given Rosex gel or cream, they're given it prescribed by a dermatologist, GP, and then typically what happens is it doesn't get audited, patient slips out of the net for a review. So obviously you've got to make sure at this point, if a treatment is greater than 3 months, they need to be called in for a review. And this is very important. Number one, to reduce the risk of obviously having it long term and then getting side effects. The drug may have worn off. And another thing is antibiotics. So obviously we've got a big drive, especially in the UK now, about taking antibiotics long term, the antibiotic stewardship, and obviously you're looking at things like antimicrobial resistance as well. And these are some of the things that we will cover in one of our later lectures about the whole use of antibiotics, why it's being rationalized now, and why we just don't prescribe it straight away. Thank you very much for listening to this presentation by CBH Education. For further videos on our pharmacy revision series, pharmacology, OTC products, OTC conditions, legal aspects of prescribing, please follow us on our Facebook, Instagram, and YouTube channel.